Nothing is ever stagnant. Change is happening all around us, even in times of scarcity. When a community becomes so desperate to fill a void, ideas become visions. We ask, if not here, where? If not us, who? If not now, when? Sometimes an individual is called upon to catalyze change. Sometimes it is a tribe. It's not easy, it's messy, it's worthy, and a whole bunch of people coming together.
There's a critical need across America and across the state of Oregon, but most acutely in rural communities such as Roseburg, for primary care physicians.
In the greater Roseburg area, we really do have a need for providers of all specialties, but especially primary care. One of our bigger issues lately has been timely access to primary care on that.
Family medicine, while we care for people cradle to grave, we're ideally suited to care for the older, sicker, and poorer populations. That compelling need is greatest in rural areas where it's harder to recruit and to retain qualified family physicians and other specialists as well. Roseburg had suffered a loss of a significant number of our primary care workforce, and the hospital CEO, Mr. Kelly Morgan, came to me and asked if I would be interested in helping to explore starting a family medicine residency here in Roseburg.
This really started 3, 4, 5 years ago now. A vision of our CEO and some community members to improve access and to improve the entire medical community. If you think about it, Roseburg, greater Roseburg area, we have a population of about 88,000 we serve. To start a residency program at first was a bit unheard of. With the leadership of a lot of people, the CEO, Kelly Morgan, Dr. Chip Taylor, and many others, brought a lot of moving pieces together to bring this to fruition. I really think it's a great idea. The community needs the excitement, the energy, the enthusiasm of a residency program. Our community needs the education, needs the services, needs those residents to help us fulfill our mission to our community members, our neighbors, myself, my family. We need what that brings to our community.
Douglas County is an outdoor paradise, which extends from the Pacific Ocean to the Cascade Range. Throughout the enchanted outdoor landscape of 360 crystal streams stemming from the north and south forks of the Umpqua River in gorgeous valleys, Douglas County boasts of some of the best fishing and hunting adventures in the Pacific Northwest. Along with its unique scenery and mild year-round weather, Douglas County is home to many wineries and world-class wines due to its climate and luscious, fertile soil.
You know, I've lived here most of my life, and I think it's the best place to live ever. I feel like other places are to visit and vacation at, and Douglas County is the place to live at.
I don't think there's a day that goes by that we don't say, it is so beautiful in this area.
It is a beautiful, beautiful, serene area, and within an hour anywhere, you can either be up in the mountains skiing or at the coast watching the ocean. We love it.
There is a severe shortage of primary care providers. The primary care provider shortage is growing across Oregon, with a projected statewide shortage of 622 primary care providers by 2020, rising to 1,174 by 2030.
Providers are key to the health of our population. On that, in a rural area such as Douglas County, specifically Roseburg, there is a shortage of primary care. The impact of that shortage of primary care leads to a lot of preventable diseases or illnesses that become more severe that could have been handled on an outpatient basis.
We were turned down for the doctor, and I thought, what in the world is going on? We're reliable people, we pay our bills on time, and we really do need to see a doctor at some point. And come to find out, there were just no doctors available.
There was a study done recently by the hospital here in the community that suggests we're short about 19 primary care providers, physicians. The so what of that is folks are having to go really outside kind of our geographical area to see primary care providers, which is not the right standard of care in my opinion. It should be very accessible.
We have had at least 2 different doctors here in town that have treated us for a while. We both have heart issues. And within about a year or so after we got started with them, they transferred to someplace else, to a better opportunity. And it becomes very difficult to find a practice that you can get into and be a part of down here.
The number one thing I hear from the community is, I'm frustrated with the provider turnover. It seems like you guys can't hold on to a provider, and I totally get that.
Providers who are part of our community and are here for a number of years become so critical to developing those trusting relationships that really begin to provide that security to our patients.
Our experience has not been different from a lot of people, that when they try and find a doctor, there are no slots available. Practices are full and doctors are retiring, and it's crisis time in Douglas County.
Research published in the Journal of Family Medicine demonstrated more than half of family physicians practice within 100 miles of their family medicine residency program. In addition, the majority of practicing family physicians remained within proximity to their GME training site.
So if we have 3 years of people living in our community and working, then the stickiness of them putting down roots into the community will make it easier to retain them. Or if we have them go somewhere else, they'll be looking for a similar type of experience.
We're looking at hoping that they will really enjoy living in Roseburg, becoming a part of the community, whether it be in social events, faith-based organizations, their children in school, that they will, at the end of their 3-year residency, think, okay, we'd like to stay here as a family. I'd like to stay here as a doctor and be a part of this community.
We had over 600 applicants for our 8 positions. And winnowing down the field, we developed a process using a tool to screen people and give a score. And we gave extra credit if you were from the Pacific Northwest, if you went to one of the medical schools in our area, if you came from a rural community. And we got about 96 great applicants that we offered interviews to.
When I was a part of the interview process, a couple of the questions that were important to me were, what were their thoughts about a rural community? Where were they coming from? If it was somebody who had grown up in the middle of New York City, would coming to Roseburg, Oregon be a tremendous adjustment for them, or were they looking for a totally new, different lifestyle? Asking questions about spouse. Your spouse going to be looking for a job? You're living in a small community where when you're grocery shopping, you're going to run into some of your patients. How are you going to handle that when you're in the ice cream aisle and your patient's asking you about something that went on with their last visit? Because Roseburg's a very small town. And it was fun to see them react, and you could tell that with some of them, they hadn't thought of things like that before, but it was like, oh, I think I'd like that.
We get a chance to interview and then rank all the applicants that we would like. The applicants get to do the exact same thing with us. So there's this computer algorithm that then makes matches. And once the algorithm says, applicant A, you're ranked with program C, that becomes a binding contract. So that's how the system works. It's a lot like computer dating. So if there's a shortage of family physicians, there's certainly a shortage of family physician educators. And being an excellent family doc in a community setting does not guarantee that you are interested or qualified or have an aptitude to be a teacher. That when we're looking to recruit, we're looking for fit as the major factor. We want quality people, but we also want people who have the same values that we espouse. But it is not easy to recruit family medicine educators to come to rural Oregon.
How does a small community train exceptional family physicians who are ideally suited for rural practice in the 21st century? This doesn't happen overnight, nor does it happen in a silo.
The process for building a rural residency is iterative and has to be focused on quality improvement. So you take the assets that you have, you figure out where you have gaps and need to bring additional things in, and then you grow the best program you can. First and foremost, we want to train exceptional family physicians who are ideally suited for practice in a rural community in the 21st century. When we think about these folks, the trainees, the residents we're going to have, and how we're going to equip them, they need to be experts in managing data and understanding the evidence and being able to translate it into action. They need to be experts in leadership of teams. They need to be experts in thinking about the individual in front of them, the population that they're entrusted to care for, and the community in which they live as the milieu in which all this care occurs. They need to be able to sustain themselves and their teammates, who will be of all different sorts of disciplines. They need to understand technology and to humanize it so that when they're dealing in the clinic with a patient, it's still that caring environment. They need to be able to translate doctorese into plain English for people who are relatively plain spoken. They need to understand how to change behaviors, and they need to understand how to treat pain and suffering without the use of opioids. And when people are addicted to those substances, to be able to help them to overcome that addiction, whether it's alcohol or methamphetamines or opioids.
The Roseburg Family Medicine Residency has teamed up with critical partners to help create team-oriented and community-involved rural family doctors that will change how we view healthcare in a small community.
You would think that we're all working towards a common good of having the healthcare system be better in the community, but unfortunately, when you have money and all of these other things interplay, it ends up being a lot more complicated than that.
So the best laid plans of mice and men, we should have had our first class of residents on board in 2019, and we don't. And the reason we don't is tied up in the lore of who will ever know. But our first teaching clinic decided that they didn't want to participate, which almost killed the residency.
That was hard. That was really hard. There were a lot of days that kind of felt like, what are we doing? Is this going to happen? Is it not going to happen? Are we going to have a program? Are we not going to have a program?
Fortunately, we were kept on life support, and I was able to pivot to the Federally Qualified Health Center. Now, that's a great thing. That's a great thing, because in our rural community, the patients at the Federally Qualified Health Center have the greatest need for great docs. They also provide the best teaching material for the residents.
It really takes people who have energy, have vision, and are willing to bring other people along. And you know, I mean, it had to start with Chip. Chip was the one who started it and really just plowed through amazing hurdles to get us to that point. And then Casey was that second person to take the reins next and do that next part.
So I had always felt that our residency teaching clinic should be at Aviva. But culturally, the FQHC and the hospital were very different. And because we were just beginning, it was much easier to envision not having to deal with two different cultures and bring them together. But in the course of this adversity where we needed to find a new clinic, we were able to do that.
So I think the initial turning point was having Aviva come on board. And having so much power of positivity from Casey. I was really impressed meeting with him and seeing how much he wanted to move this forward.
Other partnerships that are essential are with the OPTI, which is the organization which oversees our academic requirements, And without them, we would not have the ability to have a residency. And then the final key partnership is with an organization called ADAPT, which has the substance use disorder and mental health contract, for lack of a better word, for our county. And really you have 5 partners working together to create the single residency.
It's so critical as we build this program that in the early phases we have funding in place to make sure that we build it right. We build a sustainable framework for the residency program, so down the road this resource that is vital to the community and to Aviva Health and Mercy Medical Center will be in place and will be strong.
This project wouldn't have started if it wasn't for a small amount of grant money through the Oregon Graduate Medical Education Consortium, which required matching funds with the hospital to get this started. One of the things that we are very proud of was that we were able to compete through the Federally Qualified Health Center to become one of the 5 new Teaching Health Center grant recipients for this coming year. And then in addition, a workforce development grant from the state of Oregon. So ending up at the Federally Qualified Health Center gave me a different mission, caring for those people who most needed the care in our community, regardless of their ability to pay, regardless of their ability to show up for appointments on time, just regardless. And then when this opportunity came along to help train the next generation, what this gave me was an opportunity to envision what those doctors would need to be caring, compassionate physicians into the 21st century, so that we can keep those people long-term engaged in primary care for the individuals that entrust themselves to them, to the communities in which they serve, and to the discipline of family medicine and to the nation as a whole.